Good morning, ladies and gentlemen, and welcome to Vaughan City Hall. My name is Tony Carell. I'm the councillor for Woodbridge West, Ward 2, but also the chair of the Vaughan Community Health Centre, which is a partnering agency with York Central Hospital, or at least will be for a few more minutes, because I understand there's some sort of a name change going on today. Okay. We have quite a full agenda, so we're going to move right into it. I'd like to call on the Mayor, Maurizio Bevilacqua, a member of the board of York Central Hospital and of its planning committee, to say a few words of welcome. Maurizio?
Thank you very much, Tony, and thank you for the great work you do on healthcare here in the city of Vaughan. And I'm here to announce that the new name is... Dina was worried. The best idea Greg Serbar has had in years. But I do want to welcome everyone here to this multi-purpose room. But it's a great place for provincial announcements, it seems. As a matter of fact, last time we were here, Greg, and Reza, you were here as well. That's when the hospital got approved. And if I can, I just want to put this announcement into context. Great things are achieved in a community, in a society, in a country, in an organization, in a city, when people work together, when they understand that there's a greater cause at stake here. And what has been an exceptional experience for me is to see people in this room working together and never losing sight of what's really important. In this case, a hospital for the city of Vaughan. Dina, I want to thank you so much for your leadership at the board. John, Bill Fish. Bill and I go back too many years. You know, you haven't lost any hair though, which is good, and I have. Reza, that's okay. And then there's, Greg Serbar with a permanent smile. That's when I get worried. But I do want to thank you, Greg, very much. You know, I want to say to you what a pleasure it's been to work with you over the years. We go back since 1985. I always say this both publicly and privately, which means you're telling the truth, by the way, for those of you who care. That Greg has been one of the most influential members of provincial parliament in the history of this province. And because we share a party color, I can tell you that one of the reasons why this province has been under the leadership of a Liberal government has a lot to do with the great work that Greg Serbar has done. And for that, I will always be forever grateful. If I can, I want to say a few words about Altaf Stationwala. Altaf, we've gotten to know each other over the past year or so, a couple of years since I've become mayor. And I'm really impressed with your leadership. I know you're going to have even a bigger job ahead. But guys, as long as we stay focused on what really matters, we're going to do exceptionally well. Today marks the new beginning for us. Dina will be making an announcement shortly. The only one commitment I want to make, Dina, to you, and I think I also make it on behalf of David Barrow. I'd like to speak on behalf of Richmond Hill as well. It's sort of the expansionist gene that I have. But I couldn't think of a better partner to share what is going to be announced, the name, and you'll see, understand, this all makes sense, than David Barrow. I think David and I work well together because we're always focused on what matters, and that is the people that we represent. Fraser Nelson, you had an annual general meeting this morning. I understand you're back on. Good. Well, I say to you, good luck. We're going to have to do some serious fundraising, and we will succeed, and we look forward to your leadership. And in my own humble way, I'll do what I can to be helpful to you as well. Eric Fonberg, Chief of Staff, thank you for all that you do. You do a great job, and the citizens of Vaughan appreciate all your efforts. To my colleagues that are here, John, you, of course, are a great partner in this mission, and we continue to welcome your input as we move forward. As you know, you're also a very big part of this project. I want to introduce, if I may, and then I'll get off the stage, because I know that's what you want me to do. Rosanna De Francesco's here. Councillor Rosanna De Francesco's here. Marin Iafredi, Councillor Marin Iafredi is here as well. And the best deputy mayor the city has ever had, and the only one they've ever had, Gino Rosati. Yes, and of course, Alan Sheffman. Councillor Alan Sheffman is here as well. So I think that I'm going to leave this stage, and by the time I sit down, I'm sure somebody's going to have great news. To all of you, people sitting, people standing, just remember, we're in this together, and we're going to make it happen.
Thank you, Your Worship. Our next speaker is Dina Palazzi. Dina is a, hold on, got to do the introduction. I know we're all anxious, but hold on. Dina is first of all a resident of Vaughan. She has a distinguished career in the Ontario Public Service, having served as Deputy Minister, Revenue and Financial Institutions, Deputy Minister of Correctional Services, and Assistant Deputy Minister of Education. After retirement from the civil service, she became the Chief Privacy Officer at BMO Financial Group. She holds a BA from the University of Toronto and an MBA from York University. And actually, her husband Ennio and I were two centennial projects at St. Michael's College, having graduated in 1967. Dina is currently the chair of the Canadian Automobile Association South Central Ontario Board, and she was elected chair of the York Central Hospital Board of Directors in December of 2010, currently serving as chair of the Executive Committee. And now, without further ado,
thank you, Tony, and thank you everyone for being here today. It is my very great pleasure to be here on behalf of York Central Hospital Board of Directors to officially launch a new major regional healthcare mandate and to unveil our new brand. Today's announcement is the culmination of over a year's worth of engagement of over 800 people in the community in both Vaughan and Richmond Hill. In addition to the contributions of staff, physicians, and volunteers, we have also reached out to our many elected officials, and the mayor has recognized all of them for you, major donors, key opinion leaders, service groups, and generally members of the public. It is this rich and vibrant discussion that has brought us to this very exciting day. Organizations rebrand themselves for many different reasons. In our case, we have one of the very best reasons to rebrand. We have a new mandate. Our organization has been given the unique responsibility of becoming a major regional healthcare provider, which includes building a new hospital in Vaughan that will enhance healthcare services for all of Southwest York Region. With the unveiling of our new brand, we are sending a clear signal of change and evolution of our hospital into a regional healthcare system that will be designed to deliver care through 2 hospitals as well as a network of community service locations. Over the past few years, our staff, our physicians, volunteers, along with our board of directors, we have worked hard to improve the quality and the timeliness of care in the hospital. Working together, we have truly made significant strides in reducing wait times, improving patient satisfaction, and achieving sound financial performance. As we launch our new organizational brand, we celebrate a new beginning that has been built on past successes. Success that was achieved through teamwork, accountability, and leadership. The recognition and celebration of our past success provides a strong foundation for the exciting challenges that the future holds in serving the many needs of this community. So how will we serve those needs? Our vision for the new major regional healthcare organization is, quote, to create a world-class health experience for the people of Southwest York Region. This vision expresses our commitment to creating high-quality care, outstanding customer service, and the shortest wait times possible for each and every patient. Our mission for the new organization is to relentlessly improve care to create healthier communities, because that's why we're here. This elaborates on how we achieve our vision and what we need to do every single day to ensure that we reach this goal. It also speaks to the benefit that we will achieve for the people of our community, healthier communities, through our commitment to be absolutely relentless in finding ways to improve the quality of care as well as the care experience itself. So now, on behalf of the Board of Directors and the Brand Steering Committee of the Board, and on behalf of the hundreds of people who have participated in the development of this brand, it is my distinct pleasure to introduce our feature video, which introduces our new brand and explains the significance of that brand and the impact it will have on our community. When you see the results today, I know that you will be as excited as I am. Thank you.
Wow. Exactly 10 years ago this summer, Greg Sabera asked me a question. He says, is it time to put a hospital seriously on the public agenda in the city of Vaughan? In my best Italian, I replied, boh, which means, beats me, but then I said, but let me find out. I then proceeded to interview about 15 different individuals in the healthcare planning sector, presidents, CEOs of the Boundary hospitals, presidents or chairs of the board of the Vaughan, Peel, and Toronto district health councils, as they were then known, ministry staff in Newmarket. And one of the people that I interviewed is our next speaker, Altaf Stationwalla, who was then with William Osler. So we had a very long and involved and quite informative discussion over the phone. The next time I went to Greg's office, who shows up, unexpected, but Altaf, to continue the conversation. 10 years later, the conversation continues. Altaf, Chief Executive Officer of the new Mackenzie Vaughan Hospital.
So thank you, Tony. I had a lot more hair back then, right? Yeah. So this is amazing. What did you think? I can see that you enjoyed this video. It was a culmination of a significant amount of work. The level of engagement in this exercise has been tremendous, and I think we recognized from the very beginning that a name is a name, a logo is a logo, but it's how you really build it that matters. And we spent a lot of effort and a lot of time engaging you, our community, our residents, our staff, our physicians, our volunteers, in making this real. And I'm going off script, but I have to tell you, we held a similar event yesterday at our hospital in Richmond Hill, the Mackenzie Richmond Hill Hospital, I guess it's called now. We had, I think, over 500 staff in our auditorium, and obviously we wanted to launch it from within first because the staff have to live that brand, they have to believe in it. And I can't tell you, the level of excitement, the buzz was just amazing. It was amazing. Our staff believe in this future, and that's... And I think we forget that. I think we forget the fact that we are a service business. 80% of our expenditure is related to our staff. And at the end of the day, the difference in the care we provide, irrespective of the technology, irrespective of the buildings, it's all about our staff. So they have to believe in this, they have to be supported, and I think they believe, and I believe, that we have your support as a community. So that is, I think, foundational as we move forward, because we are going to be growing. And the base that we have today, in terms of our staff, is going to grow and continue to support the growth, in particular as we embark upon this very exciting initiative, the Mackenzie Vaughan Hospital. Now, I think you heard from Dina, this announcement was sort of an extensive level of work, board engagement, staff engagement, and I think probably many of you in this room participated in some of our focus group sessions, and your feedback was invaluable. And I want to thank you for that, because if we didn't have your level of engagement and your feedback, I don't think you'd see the product you have today. What's also important is this brand identity reflects not just what we are today, but it enables us to transform ourselves over the next 5, 10, and 20 years. Healthcare is more than just hospitals. Healthcare is about community-based services, and I think you can see from this articulation of what we are, it's about 2 hospitals. They're the foundation, but it's about a number of community-based services, and they will continue to grow. Mackenzie Health, as you know, is our new major regional healthcare provider formed to serve Southwest York Region, one of Canada's fastest growing communities. And I can't tell you, as much as we continue to work with the provincial government, they can't even fathom to understand the numbers and the growth, not just in terms of population, but demand for care. We have an aging population that's driving our growth over the next 10 to 15 years, upwards of 150% in terms of service demand. As you can see, Mackenzie will include 2 full-service hospitals, the existing Mackenzie Richmond Hill Hospital, formerly known as York Central Hospital. I think that's the last time I'll probably say that, and the future Mackenzie Vaughan Hospital. Along with those 2 hospitals, we have a number of regional programs that are just not offered in one location, but across Southwest York Region, and in fact, across York Region. Many of you probably didn't appreciate till today that we actually provide acquired brain injury services all the way up in Barrie. All of this is to create a world-class health experience to meet the growing needs of our community. Through our consultations, what we heard more often than not is, I want a good experience. And experience is a much broader word than just the actual episode of care. And that is about delivering appropriate service in a humane, kind way. And that's what our staff are all about. Mackenzie Health was chosen after tremendous stakeholder consultation, I've said that, and it leverages, and this came out through the consultations, the history of this community. I didn't even realize that there was a 3rd Prime Minister named Mackenzie, but that all came to be as we started to engage the community and their understanding of their roots. And I think you see that. Addison Alexander Mackenzie was a member of the Ontario Legislature. I don't know what party he was representing at that time, but a respected veteran of Vimy Ridge, for whom Major Mackenzie Drive is named. As I said, 3 Canadian Prime Ministers bore the name: Alexander Mackenzie, Mackenzie Bowl, that's for you, Eric, and William Lyle Mackenzie. The locations of the hospital are also significant, both situated on Major Mackenzie Drive. And as Mayor Bevilacqua said, bridging our 2 communities of Richmond Hill and Vaughan. Mackenzie Health will ensure our community has quality health care closer to home. Both hospitals will offer core services, and specialized services will be distributed amongst those hospitals based on appropriate location of that service and regional needs. Mackenzie Health is linked, as I said, to a number of community-based programs: diabetes education, chronic kidney disease, cardiac rehab, and these services will continue to grow, and we will continue to offer additional locations as our population grows. More importantly, the common nomenclature of this brand, the common identity, will make navigating this integrated model of care easier for patients, and I think that's fundamental. So in closing, I'd like to thank everyone for being here today. I would also like to thank the Mayor, Mayor Bevilacqua, and the City of Vaughan for hosting us in this amazing room. And I'd also like to thank all the speakers that have participated and that will be participating. Thank you for all your support. This is truly a community effort, and it will continue to be a community effort. We're very excited by the future. At Mackenzie Health, we have a very bright and exciting journey in front of us.
Those of you in the back, we're only about halfway through the program, and there's lots of seats still left over here, so please. Altaf spoke about the response of the staff at the other hospital to the new name. I'd like to introduce the Chief of Staff at York Central as of June 2011, Dr. Eric Fonberg. He's a Master of Public Health from Harvard University, a Master of Business Administration from the University of Toronto. He's a faculty member with York University's Schulich School of Business Master's Certificate in Healthcare Management, a faculty member with the Sprott School of Business Master's Certificate in Healthcare Management, and a lecturer in the University of Toronto's Department of Family and Community Medicine. A very busy man, Dr. Fonberg.
Well, thank you very much. I appreciate that. Altaf and I had a little bit of a debate about how you pronounce the name of the, was it the 5th Prime Minister? What was his name again? Mackenzie Bowell or Bowl, was it, Altaf? In any case, this is an extremely exciting moment for me personally. I think, as most of my colleagues know, I can be easily agitated, but not necessarily easily excited. So this is indeed a wonderful moment. Now, I've been in healthcare for a long time. As a matter of fact, I think when I started, Altaf was scarcely a gleam in his father's eye. So it's not often that I get to participate in an exciting initiative like this, where the organization is rebranded, we're building a new hospital, we're becoming a regional provider. This is really absolutely wonderful stuff. And I want to speak for just a moment about not so much about the role of the medical staff, but about what this means to our professional staff in general. As much as I am a physician, I would like to think that I represent our professional staff at large, and I would like to tell you how excited our professional staff are about this wonderful opportunity. I have been privileged to work closely with a fine group of physicians and allied health, other professionals, and I am completely impressed with the commitment that our professional staff have made as we move forward to achieve this exciting new mandate. We are working together to provide care that meets the highest standards of clinical quality and safety for the residents of Richmond Hill and soon to come the entire Southwest York region. My colleagues strive to do so with the utmost compassion and respect for patients and their families. As Althoff points out, this is not just about technology, it's really about caring. A new brand in and of itself is relatively meaningless without the ability to mobilize our medical staff, whom I represent. I fully expect that the new brand will galvanize our professional staff, medical staff, and others, spurring us on to greater heights in terms of clinical excellence. We have considerable strengths in a variety of specialties and in ambulatory care. Mackenzie Health does aspire to strengthen and expand the range of clinical services we provide to our community, not only technology. We have been fortunate to recruit and retain very talented medical staff over the years in a highly competitive environment, and I believe that with our new brand, we will be in that much more of a better position to continue to attract the brightest and the best. I recently completed a branding initiative at a hospital close by here when I was the board chair a couple of years ago, and frankly I was impressed at the extent to which the entire staff were mobilized by the new look and feel of the organization, including the mission, vision, and values. I want to echo what Althoff said about yesterday. The degree of enthusiasm was tenfold what I saw at the other place where I worked. I anticipate that we will do extremely well here. What we have accomplished yesterday and what we're accomplishing today is the beginning of leveraging a venerable history and moving forward to a wonderful future on behalf of patients, their families, and our communities. Thank you very much.
In the lower left-hand corner, you'll see the name Mackenzie Health Foundation. The gentleman who is going to be responsible for that is our next speaker. He's Fraser Nelson, who was appointed to the board in June of 2011, following his appointment as chair of the York Central Hospital Foundation. He's currently the general manager and senior vice president of Metris Development. He's a professional engineer from Guelph and has served on a number of boards and panels in the leadership capacity, both in the development and fundraising sectors. Ladies and gentlemen, Mr. Fraser Nelson.
Thank you. In a very short time frame, we're going to try and give you past, present, and future. So, starting with, it's my pleasure to be here today. As the mayor mentioned, I just came from an annual meeting, and we survived that, and I was appointed for another year. So, I'll carry on. No, that's okay. It's my successor I want to plan for. So the history. The York Central Hospital Foundation was officially created in April of 1977, so we do have a legacy. Our goal is and remains to raise funds for medical equipment, staff education, and capital improvements not otherwise funded by government, all of this to support hospital care. So since inception, thanks to the generous people in our communities of Richmond Hill, Vaughan, and beyond, we have funded over $65 million towards this goal, providing such things as CT scanners, our first MRI, 2 minimally invasive surgical suites, and much of the construction to build the town of Richmond Hill wing at the renamed Mackenzie Richmond Hill Hospital. So where are we at with our present? On May 15th, our foundation board unanimously voted to accept the challenge to take on an expanded mandate to raise funds for both the former York Central Hospital and to help build a new hospital in the city of Vaughan. And as you have heard, we're proud to accept the moniker now to be officially known as the Mackenzie Health Foundation. So under this banner, we intend to unite our community in the common goal of providing the best of health close to home for Southwest York Region. So what is our future? Over the next 10 years and beyond, we will be working to raise in excess of $150 million for the two major sites making up Mackenzie Health. And this will include major technology upgrades at Mackenzie Richmond Hill Hospital and, of course, launching and sustaining the new hospital in Vaughan. While the task is large, Mackenzie Health Foundation, with your help, and I'm going to emphasize that again, with your help. What's that old joke of the minister, the rabbi, or the priest says, we have a problem, we need money, but I'm looking at the solution. We're up to the challenge. We look forward to it with your active participation in this exciting future. And our mission statement remains the same, to inspire inspirational gifts. Thank you.
I just want to note we've been joined by two of my colleagues, Regional Councillor Michael DiBiase and Ward 4 Councillor Sandra Young-Racco. The operational dollars that will run these hospitals comes, of course, through the Central LHIN. And the chair of the Central LHIN, John Langs, is with us today. John is the retired from the law firm of Fraser Milner Casgrain LLP. He's a former governor of the North York General Hospital Foundation, was on the board of North York General from 1955 onwards, serving in several capacities, including secretary, vice chair, and chair of the hospital's governance committee. Should I go on, or is that abbreviated form good enough? Okay, John Langs.
Thank you very much. Don't think I started in 55, but anyway, I do appreciate being invited here today and to be here for this great announcement for the launch of Mackenzie Health. Earlier this year, the Ontario government released the Action Plan for Healthcare, which established the roadmap for the transformation of a smarter and more efficient healthcare system, leading to better outcomes. At the heart of this plan is a commitment to provide people with the right care in the right place at the right time. This approach is essential to achieving what we all want, a high-quality, person-centered local health system. Having timely access to care is critical. As a system, we need to continue to improve how we deliver care and strive to make it easier for people to get the right services where and when they need them. Mackenzie Health is a great example of how we are moving in the right direction. Through the newly renamed Mackenzie Vaughan Hospital and Mackenzie Richmond Hill Hospital, together with a number of the community-based services, Mackenzie Health will offer quality care closer to home. It will be easier for people to navigate the system, and decisions will be made based on local needs. Central LHIN is committed to working with our health and community service providers to build a more integrated and patient-centered local healthcare system. These needs will need to be addressed in the context of three major population trends, which Altaf alluded to earlier. With 1.8 million residents, this LHIN is the most populous and fastest growing in Ontario. Over the next 10 years, we'll see an increase of about 20% in the total number of people living in the LHIN, which is much higher than the provincial average of 14%. Our population is aging. In 10 years, people in Central LHIN communities over the age of 65 will increase by about 57%. This means an additional 136,000 seniors by 2022, bringing our total seniors population to 375,000. 49% of the LHIN's population is comprised of immigrants. This is the highest proportion among the LHINs, and over the next 10 years, an additional 200,000 newcomers are expected to enrich our communities. As our population ages, more people will be living longer with more complex health problems. We need to collaborate more and even more closely to share information electronically and develop new approaches to serving our ever-growing population of seniors and diverse newcomers. Central Lynn looks forward to working with Mackenzie Health to build the capacity in this community to support the provisions of the appropriate services for people that are closer to home and achieve a better standard of care. Thank you very much.
Our next speaker is the fellow who asked me that question 10 years ago, to which I gave such an intelligent response. Greg was first elected a member of provincial parliament in 1985, and he's been successfully elected in every campaign in which he's been a candidate ever since. He's held a number of senior cabinet positions, including, and most recently, Ontario's Minister of Finance. Greg has been a tireless and longtime advocate for bringing a hospital and a subway to Vaughan. And I hear that before he retires, he's going for the trifecta, the 427 extension. Greg Sorbera.
Thank you, Tony. You can't go anywhere without a little bit of lobbying, eh? There's always more to the agenda. I want to begin by just letting you all know, and particularly the mayor, that the Mackenzie Health came in a close second, very close. But then it would have to change the road name to Mackenzie Boulevard, and we're going to have, the region is not going to do that. I am just absolutely thrilled to be here today. This is, for me personally, such a momentous occasion. This is a giant step. And I want to spend a little bit of time mentioning and thanking some of the people that have participated in getting us to this moment. And perhaps best to begin with Tony and that study that he did 10 years ago. Before I do that, I want to say a little personal word about York Central Hospital as it was then. My home in Richmond Hill is a stone's throw from York Central Hospital. And for the past 25 years, it hasn't been a political place for me. It's been a place that has dealt with the fractures that our kids had. 20 years ago, it helped me through a horrible bout of pneumonia. A few years ago, my wife had a tiny kidney stone. Doctors will know that caused excruciating pain, and within a very short time, a few hours stay there, all was better. And most recently, my mother-in-law she's got an 89-year-old ticker, and it wasn't working well. And 5 days after very kind and compassionate care in your hospital, God, she's out gardening and she's off to Rama. Why do those old people always go to Rama and spend their pension checks? Because the province needs the money, Altaf. That's why. But as a member of provincial parliament for a number of years, the issue kept coming about, as Tony described it in his report, the hole in the donut, where we were missing capacity for services in the great city of Vaughan. So work began and discussions started to take place. I know down at Queen's Park, at that point we were not yet in government, but I and others started to raise the issue. It was not long after that that then Mayor and now Regional Councillor Michael DiBiase created a foundation and made a Vaughan Hospital important for the people of Vaughan. These things don't happen unless civic leaders take them on and start to become champions. And he did that so effectively. Later on, an organization that contributed mightily, the Vaughan Health Campus of Care, represented today by Lou Greenbaum, and he's somewhere here. I saw him. There he is right there. Major advances, securing a site. You can't build a hospital unless you have a site. Securing a site for a new hospital, and one that is so strategically located. and working on securing funding through the City of Vaughan and York Region. Tireless efforts. And then I'm so proud of the moment when it became clear that if we were going to have a hospital, we needed a hospital partner. We needed to build on existing capacity. And thus, the agreement of the Ministry of Health and Long-Term Care to mandate York Central Hospital, as it was then, to take on this project. Another couple of very important moments was the time when Altaf Station Walla accepted the mandate to be president and CEO of York Central Hospital, as it was then, and the wonderful Dina Palazzi said, okay, I'll take this on as chair. She has all the time in purgatory for you Catholics. Her time in purgatory has been completely eliminated. Direct to heaven. And I guess some of you in this room understand the mountain of work that has gone on over the past 2+ years. The planning work that is all part of the creation of a new facility. The skepticism and criticisms that are inevitable in this kind of work. All of that has been dealt with by a powerful determination. And I've heard our mayor say it so many times, the important issue is that we get this thing done. And today, it's not just a new name. It's the launching formally and forever of a new mission, an expanded healthcare network which is going to be driven by the very latest and best principles of healthcare, both in community and within facilities. My own aspiration is, when it is fully realized, people from all over the country and perhaps all over the continent will come to take a look to see how this operation is delivering such high-quality healthcare in challenging times. Altaf mentioned a dramatically diverse population and an aging population. Those are just some of the challenges that we are going to meet. We didn't just decide that in Southern York Region we'll build another hospital. We decided collectively that we're going to create a new mission. We're going to create a new model. We're going to expand our vision. We're going to look at these things in a comprehensive way. And that's why, for me, today is very exciting. I need to say a word or two about the mission that Fraser Nelson has taken on. People say to me, well, is this hospital really going to get built? My answer is always the same: yes, if the community now can rise to the occasion to make the contributions, not just of blood, sweat, and tears, but of cold, hard cash, because we do need to raise a lot of money. I personally have no doubt that this is going to happen. No doubt at all. The good news is we live in a rich and vibrant community, and we can take on this assignment, particularly under Fraser's leadership, and we're not only going to meet our challenges, but we're going to exceed them. Così noi avremo un ospitale qui a Vaughan, senza dubbio, siamo sicuro. In all these things, there are naysayers. There's always naysayers. I remember people saying, oh my God, you'll never get that new city hall built, and here we are sitting in a beautiful, beautiful new city hall. For years, people said to me, there's no damn way that there's going to be a subway all the way up to Vaughan. And now you can't drive anywhere in that area for want of the construction. Or, frankly, that we'd have a regional transportation system and that marvelous facility that you're building, Mr. Chair, along Highway 7. People said, oh, you'll never get that done. Our responsibility as public officials and people who care about our community is to accept the concern and the worry and sometimes the negativity of the naysayers, and to simply reassert that we have a job to do. Well, in Vaughan and York Region and Southern York Region, we have a magnificent job to do. But today, based on the work that has gone on over the past 10 years, and I want to thank all of those who have contributed over that time, we have a job to do that we are going to complete and create in Southern York Region the best healthcare system in the province, in the country, on the continent. Thanks to all of you for being here today. Merci beaucoup.
Another big funder of the capital costs and the ongoing costs of this institution is the chair, is the Region of York, whose chairman, Mr. York Region, is Bill Fish, serving an unprecedented 5th consecutive term. Bill started off as a councillor in the town of Markham in 1988, and then regional councillor in 1994. He's a graduate of Queen's University with a BCom and a degree Juris Doctor from Osgoode Hall Law School. And he's also a member of the board of the Mackenzie Health. Bill.
Well, thank you so much, Tony, and thank you for maybe beginning some of this process. Ladies and gentlemen, it is an honor to be here on behalf of my council and on behalf of 1.1 million people that now live in the region of York, which is, has been mentioned, quite a spectacular rise in population over the last 10 or 15 years. My thanks go to members of council. I think, Maritza, you already introduced all of them, but I can tell you it's an honor to be serving with the Mayor of Vaughan, with the Mayor of Richmond Hill, with the members of council are here, but more importantly, it's an honor to be serving on behalf of all the people here. I'm very excited about this. I have to tell you, for two reasons. First of all, I do have my hair, and that's very exciting, and I hope to keep that for quite a long time. But more importantly, what a terrific name, and so apropos to Southwest York Region. And I think this logo, I saw it about a month and a half ago, I think, at one of our board meetings, and I said it was brilliant then. I think I told Altaf it was absolutely brilliant, and I had to leave a bit early. I couldn't actually vote on it, but I wanted him to vote for me. And I just think it's a terrific idea. It works so well, and I think it really matches the kind of energy that we have across this region in all parts. But I have to tell you, they gave me some notes, and they always do, and I never use them because there's so many terrific speakers that were before me who said all the things that I was going to say. So I'll just sort of start a little bit differently. We talked about Fraser, good luck, and I'm going to be with you all the way, and many, many people will be with you, but it's going to be a tough task. But I know that we can succeed. There's no doubt in my mind about it. And you talked about the past, the present, and the future. I'm going to go back to the past a little bit, if I might for a moment. And about, I think, 12 years ago, I was invited to a golf game. I get invited to a lot of golf games, but this was interesting because it was the then president of Mackenzie Health Hospital, and he wanted me to play with York Central, as it then was, and South Lake, as it now called, with their CEOs. I couldn't figure out what is it that they want me to play with them. I'm not a good golfer anyway. And on the 4th hole, they revealed what their real secret was. And that was, they asked me if the region can contribute $62 million to the expansion of those 3 hospitals. After I got off the tee, having laid down on the tee, I told them that that was a 10% increase in our budget, and that was not going to happen in the next year. They wanted it. I said, but give me a little time, and over the next 5, 6, or 7 years, I think I can swing it. I think I can persuade my council to increase their budget by that much. I think we can persuade the people, or the 800,000 people then, or 750, that they should also, through their tax dollars, consider contributing, because health care was amongst the 1, 2, or 3 major concerns of our residents. Traffic and congestion was always number 1, and Greg has been very helpful to help us with the subway and to help us with our Viva Next program. It's going to help that congestion. But healthcare always came out in our polls as really a big concern. And we were fortunate. We had 3 hospitals, but the truth of the matter was they all needed expansion. No doubt about it. So council, after quite a big debate, and some people thought it was a good idea, and some people thought it wasn't such a good idea, they did agree. We were going to give them $62 million. We gave it, and I had the pleasure and the honor, and my mandate is a bit wider than just Richmond Hill and Vaughan. I had the pleasure and honor of being at the topping up ceremony, they call it, in South Lake Hospital in Newmarket. I had the pleasure and honor of being part of the York Central, as it then was, expansion of your emergency, I think the emergency department, and so on, and the pleasure of being in Markham-Stouffville Hospital as they expanded their first expansion with that $62 million. Now the key is, ladies and gentlemen, that without that commitment at that time, none of the hospitals would have been allowed to expand, because the rules are that you've got to have a community involvement, and that was the kickstart to the community. The community came on board, of course, and they fundraised, all 3 hospitals fundraised $50, $60, $70 million more, and it all got done. Then, of course, 3 years ago, or 4 years ago, I got the same call, not for golf, I think it was for a lunch, I'm not sure. They knew I was a lousy golfer, so no point in having that. And it was about what is now required amongst all 3 hospitals, and soon to be a 4th hospital. And we were asked to contribute at the Region of York through our council and through tax dollars about, I'm going to say around $300 million now. The price tag had gone up. And I knew once again that we had to have the expansions at Southlake, at Markham-Stouffville, at York Central, now called Mackenzie Richmond Hill, and I knew, most importantly, we had to have a new hospital in Southwest, in Vaughan. There was no doubt in my mind about it. But it's not easy to tell your constituents, you know, raise taxes 2% or 3% to pay for anything. And a hospital was high on many agendas, but as Greg so aptly said, there are so many naysayers. There are so many people who think, oh, I'm not going to pay 1 penny more, and I don't care what we need, I'm happy, and I don't care what happens in the future. There are so many of those that as politicians, it's hard, and you don't ignore them, but it's hard not to listen too carefully. So I have to tell you that we went back to council, and council, in a very, I think, very brave way, in the middle of a recession in 2008, 2009, 2010, we said, no, we are prepared to vote in favor of asking every single person in this region, all 1.1 million people, soon to be 1.5 million people, to contribute $12 each, because that's what the contribution is every year. And by doing that, on the average $50, $60 a family, by doing that, we can accumulate and let each of the foundations and each of the hospitals know that there will be available to them over the next number of years some $300 million plus. And that is what allowed Greg and his colleagues to be able to say, you know what, that community, they will be able to fundraise it. We know they can do it. The region came to the table through their constituents. Make no mistake, there's only one taxpayer, and you were all they. They came to the table and said that they would be there when it's necessary. Now, once again, we had lots of naysayers. People who said, I'm not paying $12 more. I don't really care. But council, to its credit, and a number of them are here, and I give all my credit, my council credit across the whole region, they realized that we had to come to the table, and we would, regardless of the political capital that we were spending on that decision. I had the occasion to be at Markham-Stouffville Hospital yesterday, and I saw the expansion that is being built there. It's an amazing expansion. It'll make such a change to that area. And I had the occasion to speak with Janet Beat, who's the CEO, I guess, of the hospital. And she reminded me again, as we were sitting having a coffee, that without that commitment that our region made to all 4 hospitals, they wouldn't be building their expansion today, guaranteed, because it's too hard. It's too hard to fundraise $200, $300, $400 million in a year or two on whatever galas and how many people, Fraser, you have to call. That's a lot of money to be able to say we have it in hand. So I was very proud to be there yesterday and see what had happened. And I can tell you, when I look at this logo, I look at this name, I'm very proud to be a part of Mackenzie Health, and we meet in the Richmond Hill Hospital. I'm very proud of that for the last year. And I'm very proud to say that we're probably going to hopefully do some expansions there because it's needed. But I'm most proud to know that in the next 4 or 5 or maybe 6 years, I'm not sure the exact time frame, that we'll all be back and we'll stand not in this beautiful building. I told Marissa this morning I'm in shock and awe every time I come here. It's gorgeous. And then he told me the multi-purpose room. I thought it'd be a little room in the far corner. I come in here, my goodness, this could be a city hall right here. It's such a beautiful room. But I'm most proud to be able to say that I hope I'm around 2017, 2018, that we'll all meet in the foyer or the multi-purpose room or whatever is built at that new hospital in Vaughan. Because, ladies and gentlemen, that's exactly what York Region, Southwest York Region, the city of Vaughan has to have. And I'm very proud to be a part of it. And I'm very proud to be speaking to you because all of you have been a part of this in such an important way that when you're there, you too will feel, as I did yesterday, watching what we had accomplished together actually come about on the ground, in the air, and helping people for years and years to come. Thank you very much for helping us get there. Ladies and gentlemen, it's my pleasure.